Order. The House will know that a member has been arrested in connection with an investigation into allegation of a very serious criminal offence. I have received assurances from the member and from the Government Chief Whip that the member has voluntarily agreed not to attend the House of Commons for the period of the bail. I, the House of Commons Commission and the House Service take the safety of our staff and the parliamentary community as a whole very seriously, and ensuring that any necessary measures are taken in respect of MPs and employees and staff. All members have access to the Independent Sexual Misconduct Advisory Service by contacting the new Sindel Independent ICGS helpline and should not hesitate to use it. While the investigation is ongoing, I believe that it will be wholly inappropriate for any further reference to be made to this matter in the House, including any attempt to name the member concerned. I would appreciate your cooperation on this matter. Right, we now go to questions. Secretary of State for Health and Social Care. Sam Terry.
Question number 1, please, Mr. Speaker.
Secretary of State.
Thank you very much, Mr. Speaker. NHS Test and Trace is consistently reaching tens of thousands of people who need to isolate each week. In the latest week's data, 84.3% of contacts were reached and asked to self-isolate where contact details were provided. Since its launch, we've reached over 300,000 people who may have been unwittingly carrying the virus and transmitting it, to ensure that they keep themselves safe and keep their community safe.
And I think the group tell the Secretary of State.
Yes. And I apologise, Mr. Speaker, if I could ask you, if I may, group this question along with the other questions 2, 3, 4 and 5.
Excellent. Sam Terry.
Thank you, Mr. Speaker. Mr. Speaker, I wonder, scientists and SAGE have continuously warned that for the test and trace system to be successful, 80% of people in contact with those with COVID must be reached, and we're well off that target, I'm afraid to say. I wonder, Mr. Speaker, whether the Minister will consider seeking advice from our European partners who have actually had a functioning system since May, or is he going to continue to allow private sector, which has no proven track record in this particular instance, and protect some of the interests of some particular companies that certain civil servants allegedly may have links with, or are we actually going to see a serious approach on this?
Yes, unlike the question, we will have a serious approach to this. I will absolutely defend, Mr. Speaker, defend to all ends the teams who work on our NHS test and trace system, the private sector companies without whom this would be impossible, the civil servants who are working day and night to make this happen. I will not have disparaging remarks about civil servants made in this House by the honourable gentleman who do so much during this pandemic. And anyway, Mr. Speaker, I don't think he was listening to the answer, because the latest week's data show 84.3% of contacts were reached and asked to self-isolate where contact details were provided.
Mary Robinson.
Thank you, Mr. Speaker. Children residents welcome the release from the restrictions from the intervention measures, which will take place tomorrow, and they welcome the more local approach to this as well. Effective test and trace has been a really vital part of getting us to this position and keeping those rates low. In order to continue with this, would the Minister consider devolving testing of positive cases to local authorities like Stockport, which have a 99% positive rate of success?
Yes, my honourable friend has played a very important role, and I pay tribute to her and her community in playing the role to the success of the local action that we had to take in Stockport and other parts of Greater Manchester, meaning we were able to release the measures last week. And I'm grateful to her work and the work of her council and other local leaders, and most importantly, the people of Stockport who have worked hard and followed the rules, and the case rate is coming down. She's absolutely right that the integration of a national system that can move fast at scale and the local system where often they can reach more contacts because the boots on the ground and people who know the communities inside out, it is the integration of the two that is critical.
Plastic.
Thank you, Mr. Speaker. How does my honourable friend's assessment compare to other countries' track and trace programmes, and what lessons are we learning from countries such as Germany and South Korea, who seem to be having some success with their own systems?
Yes, absolutely. Well, of course we learn the lessons, and I talk to my international counterparts, including in Germany and and South Korea. Actually, compared to international systems, with our rates now, with the figures I've just read out, we are absolutely in the top tranche. And we're constantly looking all around the world to how we can improve the operation of test and trace.
Lynn Saxby.
Thank you, Mr. Speaker. Devon's Director of Public Health has confirmed we in North Devon have had no statistically significant increase in cases as a result of the return of tourism. Can my right honourable friend confirm that Test and Trace will ensure that this remains the case?
Well, I pay tribute to my honourable friend for everything she's done to stick up for North Devon in this difficult time, and I'm really pleased that there is no evident increase in COVID in Devon as a result of the tourism, because so many people go to Devon during the summer, especially because it's such a wonderful place to be. And we must ensure that through test and trace and through the social distancing, which is the first line of defence against this virus, that remains the case.
Sarah Jones.
Thank you, Mr. Speaker. Mr. Speaker, COVID hit Croydon and the rest of London early and hard, but Croydon has done us proud, and the number of infections have been very low for a number of weeks now, thanks to the hard work of the people in the borough. We welcome the move towards more local track and trace, where expertise and local knowledge make all the difference. But as my Director of Public Health said to me, we've just finished the beginning of this thing, and we're now starting the next chapter. And one of the things that keeps her awake at night is the need for certainty about budgets for outbreak control plans beyond the end of the year. Can the Secretary of State provide some reassurance?
Well, absolutely. I'm glad of what she says about the constantly improving integration between the national and the local system, and we've worked hard to make that happen. I'm glad to hear that it's happening in Croydon as it is in other parts of the country. Of course, the budgets around this are important. We've been clear that the financial provision will be made. I can't make any more definitive statement than that at this stage, but of course it's a very important consideration.
We're heading up to Scotland to the SNP spokesperson with Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. Since June, the Scottish public health-based tracing system has managed to trace 99.7% of positive cases and almost 99% of their contacts. Yet in England, the commercial Circle call centres have traced less than 60% of contacts. Can the Secretary of State clarify if there are any targets included in the £10 billion contract with Circle, and if so, are they being met?
Secretary of State.
Well, obviously, if I correct it, there isn't a £10 billion contract with any private company, but the private companies have been absolutely critical in the working of making sure that the whole testing system can be built at the scale that it has. And as I just said in my statement, the improvements are continuing, and we're seeing that local engagement, which is critical, and we're seeing the testing rolled out right across the UK. For instance, in the local outbreak that happened in Aberdeen over the summer, we were able to use the UK resources to get huge amounts of testing into Aberdeen, thanks to the collaborative work between the UK government providing the UK testing and, of course, the Scottish government who were responsible for the lockdown.
We now return to Dr. Philippa Whitford. Dr. Whitford.
That doesn't address the fact that the call centre system run by Circle has only managed to contact 60% of people's contacts. Regional Public Health England teams have been working flat out for the last 7 months, and they are tracing over 95% of the cases they deal with. So does he really think the middle of a pandemic is a good time to be threatening their job security with a huge reorganisation?
Well, the answer to the first part of the question is that, of course, when you're trying to reach scale fast, then we use the national system, but then that engages with the local system, as we were just hearing, for instance, in Croydon, so that you can then get the boots on the ground to find those contacts that can't be contacted through the national system. It's the combination of the two that actually works best. And as for making sure that our systems and our national systems are in the best possible place to tackle coronavirus going forward, I absolutely think it's right constantly to be seeking to make improvements to how this operates. And that's why I announced the changes that I did.
Shadow Minister Justin Madden.
Thank you, Mr. Speaker. In some areas, the private companies involved in test and trace have been reaching less than half of the contacts they're supposed to, not the 80% that the Secretary of State has claimed. So you don't need an algorithm to work out that their performance, when compared to local public health teams, is where test and trace is failing. So why then is it that this government is rewarding private sector failure by extending those contracts?
Mr. Speaker, as I've just explained, the test and trace system at a national level makes the immediate and very rapid first attempt at contact. And if no contact is made, then the local teams can go in, and it's the combination of the two that works best. But I really think that the opposition is making a mistake, and especially coming from the front bench, making a mistake trying to divide people between public and private, whereas actually everybody's working very hard together to deliver the control of this virus.
Question number 9, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. We recognise there will be increased pressures on the NHS and social care during winter, and substantial preparations have been and are being made. The NHS has already published its winter plan, and we will shortly be publishing the winter plan for social care.
Patrick Gray.
Mr. Speaker, and that's exactly why there is a need for significant additional funding in order to prepare for a surge this winter. And that has to include a fully funded pay rise for health and care staff. At the height of the crisis, the Secretary of State was saying now is not the time to consider a pay rise. So when will the time be? Is it now, or will it be some point in the future?
Minister.
As I expect he knows, we have announced £3 billion of additional NHS funding for the winter, and we are continually looking at any additional funding needs for social care.
We now come to Shadow Minister Dr. Racina Hancock.
Thank you, Mr. Speaker. There's a looming mental health crisis this winter, and as such, it is absolutely vital to meet with experts. I know that the Secretary of State believes this is important, so Mr. Speaker, I asked him several parliamentary questions wanting to know how many mental health trusts and organisations he met with during the first 3 months of lockdown. I was told, and I quote, that he holds these meetings regularly. However, a Freedom of Information request revealed that the Health Secretary and Mental Health Minister only organised 2 meetings with mental health trusts and organisations during this entire period. We on these benches are wanting to know if the Secretary of State can confirm that he did not attend either of these 2 meetings, and does he think this is an acceptable track record?
The Secretary of State has regular meetings about the future of mental health for stakeholders.
FOI, have an FOI.
Sir David End.
Question number 11, Mr. Speaker.
Secretary of State.
Thank you very much, Mr. Speaker. On the 18th of August, I announced the establishment of a brand new organisation to provide a world-leading approach to public health protection and resilience, the National Institute for Health Protection. And this will bring together the health protection expertise of Public Health England, the Joint Biosecurity Centre and NHS Test and Trace under unified leadership. And it'll start work immediately to boost the UK's ability to deal with COVID-19.
Sir David.
Everyone accepts that my right honourable friend's priority at the moment is fighting the invisible enemy. But with winter approaching, there will be many people worried about the threat of flu. So will my right honourable friend tell the House, are there any special arrangements for those people who wish to receive the vaccination? And does he have any further news about the reopening of all GP surgeries?
Yes, Mr. Speaker, the flu vaccination programme this year will be the biggest in history. And as I was going to say in my statement, but I'll say it now for my right honourable friend, we are proposing and putting before the House proposals to expand the number of NHS clinicians the qualified clinicians who can administer vaccinations, whether that's for the flu programme, which we know is coming, or for a COVID vaccination programme, should a COVID vaccine come off.
Mr. Alex Norris.
Thank you, Mr. Speaker. The NHS Confederation, the BMA, the BDA, NHS providers, the Royal Society for Public Health, and so many health charities have expressed real doubts over the Secretary of State's plans for Public Health England. It is evident that come what may, the Secretary of State is going to have his own organisation for tackling disease, and come what may, he'll be picking which of his pals he wants to lead it. But he seems to have ignored the fact that Public Health England also leads crucial work on tackling drugs and alcohol misuse, reducing smoking, promoting better sexual health, and much more. 6 weeks ago, obesity was the Prime Minister's priority, and now the Health Secretary wants to cut the organisation that leads our fight against it. Mr. Speaker, will the Secretary of State end the confusion today by committing that the remaining functions of Public Health England will continue to be led by a dedicated national organisation?
Well, the honourable gentleman obviously didn't read the announcement, because part of the purpose of having a dedicated National Institute for Health Protection is also to ensure that the ill health prevention agenda, the health improvement agenda, is embedded fully right across the health system, including the NHS. And this is a good day, Mr. Speaker, to discuss this, because just this morning the NHS set out its next steps in its diabetes prevention and remission programme, and embedding the anti-obesity drive right across the health system, including in the NHS, is an absolute critical part of its future, and we're consulting widely on making sure we have the right and the best organisational structure to deliver this.
Suzanne Webb.
Thank you, Mr. Speaker. Firstly, I'd like to thank the Secretary of State for the question number 13.
Minister.
Thank you very much, Mr. Speaker. With your permission, I would like to group this with questions 14 and 15. In July of this year, my right honourable friend, the Prime Minister, announced £3 billion of additional funding to help the NHS address the challenges of winter. In addition to which, in August of this year, we set out an extra £300 million for the enhancement of UEC capacity and to provide infection control measures.
Suzanne Webb.
Thank you, Mr. Speaker. Firstly, I would like to thank the Minister and the Secretary of State for the forward-thinking measures to support winter capacity in our hospitals. We should not, however, forget the work of the hospices, who have no season and who work compassionately all year round. Will my right honourable friend and Minister and the Secretary of State join me in visiting one of the jewels in the crown of my constituency, which is the Mary Stevens Hospice, who, due to COVID-19, have had to delay the official opening of their day service unit?
My honourable friend is absolutely right, Mr. Speaker, to pay tribute to the amazing work of hospices. She's also right to highlight the work of Mary Stevens Hospice in her constituency, of which she is a great champion. I very much look forward to taking up her offer to visit.
We now come to Andy Carter.
Thank you, Mr. Speaker. Can I also thank the Secretary of State for the investment into Warrington A&E announced recently. The additional £4.3 million will create a treatment plaza and, most importantly, a new paediatric A&E unit for the hospital. Now, this investment is very welcome for the short term, but can I ask the Minister and the Secretary of State to meet with me to discuss the longer-term issues for our hospital, for plans for a better healthcare facility in Warrington South, better parking, and in the long term, a new hospital?
Minister.
Well, I'm grateful to my honourable friend. He's right to highlight the investment we're making in NHS infrastructure, as I believe he did recently in his Warrington Guardian column. He is well known for his energetic campaigning on behalf of his constituents for a new hospital. While such decisions are for the spending review, I'd be very happy to meet with him.
Thank you, Mr. Speaker. I want to welcome the extra £1.6 million the government is investing in Ipswich Hospital's A&E department ahead of the crucial winter period. But on the topic of A&E, will the Minister build upon this work by ensuring that the new plans for a £25 million A&E department at Ipswich Hospital are accelerated? If this were to happen, it would go some way to alleviating my constituents' concerns about the merger of Colchester Hospital.
I'm grateful to my honourable friend. He, when I visited him, I think earlier this year, made a powerful case for the longer term for a new A&E department at his hospital, a cause which he has been the driving force behind. I know the Trust are keen to progress this, and I would hope and expect they are engaging with him. While the spending review will see the final decision on spending on this by the Chancellor, his voice has been heard loud and clear.
Teresa Villiers.
The capacity of Barnet Hospital to cope with winter pressure is being assisted by a brand new modular ward with 35 beds. Can the Minister assure me that there'll be continued investment in expanding NHS services in Barnet so it can cope with any COVID pressures this winter and also help clear the backlog of people who've been waiting for treatment for other conditions?
Minister.
As my right honourable friend highlights, the new modular 35-bed ward at Barnet Hospital will add to its capacity to cope with winter pressures, and more broadly, we've invested £2.5 million in the Royal Free London NHS Foundation Trust, of which Barnet is part. She is, of course, right to make the case for continued investment in the longer term, with her typical effectiveness and commitment to her constituency, and I'm always happy to discuss that further with her.
Number 17, sir.
Minister, Secretary of State.
Thank you very much, Mr. Speaker. With your permission, may I answer questions 17 and 18 together? We've developed capacity to over 200,000 antigen tests per day across the testing programme. We're planning for the next phase of testing and are committed to rapid and accessible testing at scale for everyone who needs one. Localisation of testing in accessible places is absolutely critical.
Thank you, Mr. Speaker. Thank the Secretary of State for his answer. And he may well be aware of the outbreak in my community in Newcastle-under-Lyme, centred on the Silverdale Working Men's Club. The outbreak appears to be under control, and I'd like to praise his department for their support and also Staffordshire County Council. Close to 2,000 tests have been carried out, and a number of those at the new local centre on the Rycroft. If I could make one suggestion based on our experience of this outbreak, it's that the online booking system needs to react more quickly to make spaces available. There have always been spaces available, but they haven't always been available online, and if you could comment on that.
Yes, I'm very grateful to my honourable friend for the work that he's put in over the summer to make sure that the challenges that we've seen in Newcastle-under-Lyme are dealt with as well as possible. Of course, when we put in extra testing, an extra mobile testing unit, making sure that that is tied in with the online booking system is critical. I'm very happy to work with him to resolve the specific issues in Newcastle.
Perkins.
Thank you, Mr. Speaker. Alongside the need to increase capacity, there's a real need to make sure that what's already there is working properly. In Chesterfield, I've had many people contact me over the summer to say they've been waiting 4 or 5 days to get a test result back. And I've also had people that have applied online and been told to move to go for testing 20, 30 miles away when there's a testing centre in Chesterfield, with Chris Hopson of the NHS Providers Organisation saying that the current system isn't even fit for purpose, much less world class. Will the Secretary of State tell us what he can do to ensure that the system is ready when we approach the potential increase in cases in the autumn and winter?
Well, of course, we're constantly working to improve the system, but as the statistics I read out at the start of this this question time shows, we have made very significant progress over the summer. You know, the NHS Test and Trace is just over 3 months old and is now reaching 84% of those contacts when the contacts are given. In terms of the testing expansion, of course, when a testing site is full, then people will be directed to a nearby but not immediately close testing centre. And when there's an increase in demand for testing, then that sometimes does happen. But what we try to do is respond by putting more testing in where it is needed and in the highest risk areas, which thankfully Chesterfield is not.
Question 19, sir.
Secretary of State. Mr. Speaker, the UK government is supporting the COVID-19 response right across the country. We've established the Joint Biosecurity Centre, ensuring decision makers in Scotland and across the UK have the best possible information when responding to outbreaks. And the UK-wide Test and Trace programme has significantly enhanced the ability to respond to COVID-19 in Scotland, notably through the 6 departmental funded testing sites and 18 mobile testing units, with additional ones deployed, for instance, to Aberdeen during the recent outbreak there.
Andrew Bowie.
I thank my right honourable friend for that answer. One of the things that has been welcomed in Scotland has been seeing both of Scotland's governments working together to fight this pandemic. For example, the British Army working with the Scottish Ambulance Service and local NHS boards to increase our testing capacity. Can he confirm that this one nation approach to tackling COVID will continue in the future?
Yes, there's absolutely no doubt that the combination of the UK government putting in place the capacity that you can only get because we are one united nation, working in concert with the Scottish Government and local councils who have the people on the ground who are in the communities. The combination of the two is the strongest possible approach to responding to an emergency like COVID-19.
Chris Matheson.
Question 20, please, sir.
Minister.
Thank you, Mr. Speaker. The government's clear that we'll do everything we can to protect the most vulnerable. We will not tolerate the false advertising of alternative cancer treatments. It's dangerous, but it's cruel. We will ensure penalties are handed out for any breaches of the law. And whilst there's no plans to bring in complementary therapists into regulation at present, many are registered on a voluntary registers accredited by the Professional Standards Authority for Health and Social Care, ensuring patients can access safe care.
Christian Matheson.
Speaker, my constituent Linda died of untreated breast cancer after she'd been seduced, we believe, by advertising on the internet, offering alternative therapies such as scams and pastes that were actually caustic to her body. And she died alone in my constituency some months ago. Can the Minister consider bringing in tough restrictions on advertising on the internet, particularly as people are using more, accessing internet therapies more now, and also tough restrictions on the people who practice these bogus therapies?
Minister.
Thank you, Mr. Speaker. I thank my honourable friend. I was really saddened to hear of the death of his constituent and fully agree that we must protect people who are often so desperate to find something that will help them and give them hope of recovery. Under the Cancer Act of 1939, all advertising of cancer services and treatments is prohibited wherever they may be advertised, online or in the paper, including complementary or alternative services and for treatment that purport to be able to cure cancer. We do know that the role that the internet can play in spreading harmful messages about alternative treatments is dangerous, and I've discussed the issue in its broadest sense with my DCMS colleagues and give him assurance we're committed across government to taking any further action needed. He knows that my door's always open and I would be happy to continue this conversation at any point.
Question 21, Mr. Speaker. Minister.
With your permission, Mr. Speaker, I will take this question and question 22 together. We know those who receive social care amongst the most vulnerable in our society. The Department of Health and Social Care has strived to support the sector throughout this pandemic, providing extensive guidance, extra funding, emergency supplies of PPE and prioritising access to testing.
Speaker, can I just express my very sincere thanks for all the help that social care services have provided throughout this ongoing crisis. But can the Minister assure me that we have learned all the lessons from the shielding programme and that the social care sector is adequately prepared for the coming winter months?
Minister.
Well, I'd like to join my right honourable friend in thanking all those who work in social care for their commitment and compassion since the start of the pandemic. We have indeed carried out work to understand the impact of shielding on people's health, and we will shortly be publishing our winter plan for adult social care, setting out our preparations for winter and in the event of a second wave.
Thank you, Mr. Speaker. Can my honourable friend confirm that every care home in England has either received a test, a coronavirus test, or is about to receive a test?
Minister.
Yes, I can. Every CQC registered care home in England has indeed been offered testing, and in fact care homes for those over 65 and with dementia have been offered repeat testing. We've now opened up repeat testing to care homes for working age adults.
Shadow Minister Liz
Thank you, Mr. Speaker. Following up from that question, ministers initially promised weekly testing for care home staff by July the 6th. They then abandoned that pledge and said routine tests wouldn't happen until September the 7th. With more than 15,000 deaths from COVID-19 in care homes so far, and winter and the flu season fast approaching, regular weekly testing of care home staff is critical. So will the Minister now guarantee that every care home will have weekly testing for their staff by Monday to help keep all of our loved ones in residential care safe?
Minister.
We are indeed determined to support social care and particularly the care homes with repeat regular testing. As the Honourable Member knows, because we have spoken about it, there has been a delay to our repeat testing of care homes because of a particular issue with some of the test kits, and this was communicated to her and to the sector. As I just said in my previous answer, we've now been able to offer repeat testing to all care homes for older people. We've been able now to open up the portal to those with working age adults as residents, and we've initiated our second round of repeat testing for the older sector.
Martin Vickers.
Number 24, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. I thank my honourable friend for his question. He and I have had the opportunity in the past to discuss his hospital trust, and I pay tribute to its work. I am conscious his trust has faced financial challenges, running a £57 million deficit a year ago. That has now been halved, meeting the financial control total. I also understand income levels at his trust have increased by 22% since 2015-16 to last year.
Martin Vickers.
I thank the Minister for replying, also for meeting me and my honourable friend from Grimsby before the recess. Could I emphasise the importance of the Diana, Princess of Wales Hospital in Grimsby that serves my constituency as well? They need 150 to 200 million pounds of major infrastructure work to avoid infrastructure failure. Could I urge the Minister to consider that and bear in mind the pressures on the Trust as he considers the additional resources?
Minister.
My honourable friend quite rightly raises the Diana, Princess of Wales Hospital in Grimsby. He's raised it with me before. I give him that commitment.
Kearns.
Number 25, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. The Prime Minister is clear that we must care for the health of our population. In July, we published the ambitious strategy to empower adults and children to live healthier lives, taking forward actions from the previous 3 chapters of the Childhood Obesity Plan and laying out a series of initiatives. It sets out an overarching campaign to reduce obesity and gives measures to get the nation fitter, to protect, importantly, against COVID-19, to protect the NHS, but most importantly, to improve individuals' health and well-being and quality of life.
Thank you, Mr. Speaker. There is strong support for the government's ambition to reduce obesity amongst children and young people in particular. Now, there are many calls for advertising bans for broadcasters for high salt and sugar content, for example. But those are not as straightforward as they would suggest, because it has the risk of driving advertising online, which is far more targeted and some might believe to be much more effective in communicating their message to attract people to buy those products. So does the Minister recognise that this is a complex picture that needs lots of analysis before clear policies are decided upon?
Minister.
Thank you. I thank my right honourable friend for the question, and I know he has a keen interest as a keen marathon runner in us all keeping fit. I couldn't agree with him more. Our children consume their online watching is considerably more than terrestrial television, and that's precisely why we've included a consultation in the online space to ensure that we've fully considered all of those impacts that he's just mentioned before we move forward, and any changes to advertising restrictions before they're introduced.
Heather Wheeler.
Question 26, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. We will deliver 50,000 more nurses for... with your permission, Mr. Speaker, I will group this question with question 27. We will deliver 50,000 more nurses for our NHS. We're increasing the number of student nursing places on degree courses, improving the experience of working in the NHS so fewer nurses leave, and we'll also add to our homegrown nurses through international recruitment. I'm happy to report that we now have 13,840 more nurses in the NHS than a year ago.
Thank you very much, Mr. Speaker. I thank my honourable friend for her answer. Would she agree with me that the changes made by Project 2000 in 1986 led to a large group of caring people being excluded for training to be nurses? If we are to recruit many more nurses, I think this approach should be rethought, with recruits once again being able to learn on the job as they did prior to 1986. This would bring nurses' education much more in line with the government's recognition that university is not for all children and fulfil our objective to have apprenticeships in all walks of life.
My honourable friend makes an extremely good point. We want all those with the capability and aspiration to become nurses to be able to do so. That's why we're supporting multiple routes to becoming a nurse. While the majority of new nurses take the university route, another option is the degree apprenticeship, which enables students to earn while they learn. And last month, we announced a £172 million funding package to double the number of nursing apprenticeships.
Angela Richardson.
Thank you, Mr. Speaker. I'm delighted to hear that we're successfully recruiting into the nursing profession. Does my honourable friend agree that it's not just school leavers, but dedicated and caring people of all ages and diverse working backgrounds who have the transferable skills needed to start nursing qualifications? And will she outline what steps her department is taking to engage with these individuals and encourage them to consider nursing as a vocation?
Minister.
Thank you, Mr. Speaker. I completely agree that nursing should be open to all men and women from diverse backgrounds. Our £5,000 grant to all nursing degree students starting this autumn will help students with the cost of that degree course. In addition to the apprenticeships route I just mentioned, in January we're launching an online blended nursing degree to give another route into nursing.
Jim Shannon.
Thank you, Mr. Speaker. It's nice to see you in your place again. Question number 28.
Sorry, I'm a little keen, Mr. Speaker. I thank the honourable member. Diabetic eye screening has continued throughout the pandemic for those at the highest risk. NHS England and Improvement is working closely with service providers to ensure that where services took the decision to reschedule screening appointments during the pandemic, those services are restored as soon as it's safely possible to do so in order to minimise any risk to individual patients and with appointments based on clinical need.
Jim Shannon.
Again, I thank the Minister for her response. As always, it's very comprehensive. In relation to diabetes, can I also ask a question about screening but also about weight loss? Can the Minister state outline what funding has been set aside for those who are morbidly obese and need gastric procedures urgently to set them on the path to better health? As per the Prime Minister's statement in reaction to the massively increased risk of death from COVID-19 for those who are obese, it's very important to address all of the issues.
I thank the honourable gentleman. So along with our world-leading obesity strategy that I spoke about earlier, we've also announced today a targeted dietary approach to diabetes. From next week, thousands of people will be able to access a rigorous weight loss programme to help tackle type 2 diabetes. The diet and lifestyle plans have been shown to put diabetes into remission for many people recently diagnosed. This will provide 5,000 more patients with the first stage in an NHS drive to increase access to the NHS Diabetes Prevention Programme, and it builds on the commitment to get another 200,000 people into the life-changing programme. We know diabetes increase the risk of other health challenges and coronavirus, so it's vital we take action immediately to help them.
Question
number 29, please, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. As the Honourable Lady knows, the negotiations with the EU on our future relationship with it, following the end of the transition period, are ongoing. This government is delivering on its pledge to respect democracy and the referendum result, with the UK engaging continuously and constructively in those negotiations. We must await the outcome of those negotiations, in which health-related aspects are a very important part, rather than prejudging what will emerge from them.
Thank you, Mr. Speaker. In just 4 months' time, new customs bureaucracy will lead to increased drug costs for the NHS, including insulin, which the UK doesn't produce. Pharmaceutical and medical supply firms report that they're struggling to rebuild last year's stockpiles because of global shortages due to COVID. How does he plan to ensure that patients won't face any shortages next year?
Minister.
Well, I'm grateful to the Honourable Lady. The Department is putting in place a multi-layered approach to help ensure the continuity of supply of medicines and medical products in any case that might fall out of the negotiations and at the end of the transition period, and we are confident we will maintain continuity of supply.
Sarah Olney. Not here. Daniel Zeitner.
Number 31, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. GPs with symptoms can be tested through the self-referral portal, and in addition we are launching pilots in Northamptonshire, Peterborough and Cambridgeshire to provide regular COVID-19 testing for professionals who visit care homes regularly and provide services which can become within 1 metre of residence.
Thank you, Mr. Speaker. That's all in the future, of course. I was talking to GPs in Cambridge last week, and they told me about the difficulty they have in getting tested before going to care homes. Indeed, one of them told me she had to pretend to be a care worker to get a test. That cannot be right after all this time, can it?
Well, Mr. Speaker, as I said, the pilots are now being launched in Peterborough, Cambridgeshire to provide regular COVID-19 testing professionals, and I would think that problem is probably resolved.
We're now going to wander up to Yasmin Qureshi in Bolton. Yasmin Qureshi.
Mr. Speaker, the Minister is aware that the Cumberland Review has clearly set out government failures, Primidos not being withdrawn, and thousands of babies being born with severe deformities. Does she think it's acceptable to cite legal action, which has no bearing on this report's finding, to continue to delay the justice for the families? Will she meet with me and the APPG to discuss a roadmap to implement the recommendations for all the 3 causes without further delay?
You wish, Minister.
Thank you, Mr. Speaker. We welcomed the Cumberland report. We are looking into the recommendations that were made, but the Honourable Lady knows that as a result of live litigation, I am not able to comment further.
33 withdrawn, so we go to Bambos Sarah Lombos.
Thank you, Mr. Speaker. Question 34.
Minister.
Thank you, Mr. Speaker. So, guidance to explain the government's policy on face coverings continues to be updated and fully takes into account groups with protected characteristics. This guidance makes clear that there are exemptions for people who are unable for a variety of reasons to wear face coverings. We have also run a proactive communications campaign to make sure people are aware that some people are unable to wear a face covering in certain circumstances.
I'm not sure.
Georgina Fellows is a rape survivor who suffers from post-traumatic stress disorder when her mouth is covered. Georgina and others like her have been challenged for not wearing a mask in shops and on public transport, which causes further stress and anxiety. So does the Minister support Georgina's campaign for a badge to identify people who legitimately can't wear a mask, and will she consider raising awareness of this issue via a public information campaign?
Minister.
Thank you, Mr. Speaker. I was incredibly sorry to hear what Georgina has been through and fully understand that she and others who have undergone traumatic experiences cannot wear a face covering without distress. And that's why our guidance and public messaging has been very clear that there may be people who should be exempt from wearing a covering for a variety of reasons. It's also clear that people don't need to prove it when challenged. We are actively engaging with stakeholders and charities to help ensure these messages sensitively get across, and we will continue to do so. But I would, of course, welcome a fuller discussion with my honourable friend about anything we can do to further help individuals like Georgina.
We're now having to go to topicals, so Secretary of State, topical 1.
Thank you very much indeed, Mr. Speaker. As well as our work to fight coronavirus, we are continuing our historic levels of investment into the NHS. Good progress is being made over the projects for 40 new hospitals, and the number of NHS nurses in England has increased by over 13,000 compared with this time last year, and the number of doctors up also by over 9,000. This landmark investment is bearing fruit.
Can I welcome back my good friend Tony Lloyd? Tony Lloyd.
Thank you very much, Mr. Speaker, for that welcome. And I'm one of those who most certainly owes an awful lot to the care and dedication of NHS staff. But can I ask the Secretary of State Health Ministers a very simple question? One waiting list which is going up has been the amount of time overseas doctors offered jobs in the UK have to wait for a visa. Can they have a quiet word with Home Office ministers and make sure we have a joined up government and these doctors who are part of the solution can get those visas?
Yes, Mr. Speaker, can I join you in welcoming the honourable member back to the screens and hopefully one day soon back to the House in person. The question he raises is an important one. I'm working with the Home Office to introduce the NHS visa, which will not only mean that the numbers are uncapped, but also that the administration around visas is much reduced. It's not just about Home Office administration, it's also about reducing the burden of bureaucracy from the GMC and others, and the GMC are working incredibly hard to reduce the bureaucratic requirement while still ensuring that any doctors that come to practice in this country are properly, fully qualified and can speak English to the high enough standard that people of Rochdale and the whole country would expect.
Select Committee Chair Jeremy Hunt.
Thank you, Mr. Speaker. The ongoing problems in maternity units in Shrewsbury and Telford and East Kent hospitals have shown that independent, blame-free investigations into baby deaths have never been more important. So will the Secretary of State confirm it is still the Government's intention to put the Healthcare Safety Investigations branch onto a statutory footing and that those plans will remain in the Queen's speech later this year?
Secretary of State.
Mr. Speaker, nobody has done more for the cause of patient safety in this country than my right honourable friend. And we are seeking to put the Health Service Investigatory Branch into law at the earliest legislative opportunity. He will know that as a minister I couldn't possibly preempt what Her Majesty might say in a few months' time in the other place. But I will say that in the same way that we introduced this bill just before the election, it is our full intention to legislate for it at the earliest chance.
Shadow Secretary of State Jonathan Ashworth with the first of two questions.
Grateful. I listened carefully to the Secretary of State's response to the honourable member from Southend. Can he guarantee that he has currently sourced enough flu vaccine to vaccinate all 50 to 64-year-olds by Christmas?
We have the biggest flu vaccination programme in history, and we set out very clearly when we announced the plans our proposals, which are that we will vaccinate those who are clinically most vulnerable, which starts with the over 65s and those with another health condition which causes them to be particularly vulnerable to flu, and then move to vaccinate the 50 to 64-year-olds. We set that out several weeks ago. It is exactly as clinically recommended to make sure that we not only have the biggest flu vaccination in history, but we get it to the people who really need it first.
I think he was saying there he can't guarantee vaccinations for all 50 to 64-year-olds, but we are heading into a difficult winter. He knows that, the whole House will know that. One area of the health service that is particularly under pressure is rehab services and community mental health services, because they're often now treating people who have had COVID and have long-term conditions associated with having COVID. Yet many local areas are currently putting up local community and public health contracts out to competitive tender. This could mean staff being made redundant, it could open the door to the Virgin Cares coming in. At the very least, it's distracting and wasteful. Will he halt all competitive tendering of community and public health contracts until the end of the pandemic?
What I'll do is I'll ensure that we put the best possible resources to improve the public health of the nation. And that is our goal, that is our policy. It's of course follows on from the policy that was put in place by the government of which he was a behind-the-scenes part. He knows very well, Mr. Speaker, that I admire the work that he did when he was trying to expand the provision of health services. And no matter where those health services come from, what matters is the quality of the service that people get on the front line. And that's what we'll be focused on this side.
Anthony Higginbottom.
Thank you, Mr. Speaker. Tomorrow, the people of Burnley will have the additional restrictions that have been in place for the last month removed. And that's only been possible because of the efforts and sacrifice of people across Burnley. And so I wanted to start by putting on record my wholehearted thanks to people in Burnley, Padiham and all of our villages. These have been difficult measures, but they have been effective at driving down the virus. Could the Secretary of State reassure me, though, that as an area of enhanced support, we will still get access to government support to make sure that we continue to make progress?
Mr. Speaker, my honourable friend has been a tireless advocate for Burnley. He's quite right to praise the people of Burnley who've had local restrictions put in place, and because of the actions they've taken and because they've followed their duty and followed those rules, tougher rules, and the sacrifices they've made, the case rate has come down in Burnley, and I pay tribute to him and every single resident of Burnley who's played their part. Absolutely, the enhanced support will continue in Burnley, as it does across those parts of Greater Manchester and East Lancashire and West Yorkshire that we've been able to take out of the most restrictive measures, and we continue to watch with vigilance.
Bob Blomfield.
Thank you, Mr. Speaker. The Secretary of State will know that on Friday, the Royal College of Nursing launched a campaign for a 12.5% pay increase, which will do only a little more than restore pay to the real pay to the value it had in 2010 when the Conservatives were elected. Now, there is huge public support for all who work in our health and care system. So ahead of the budget, will the Secretary of State commit to pressing the Chancellor for the funds necessary to pay all our health and care staff properly?
Well, of course, we've put in, over the last 2.5 years, some very significant pay rises for nurses, and this whole House commends the work that the nursing profession as a whole and each individual nurse has done during this pandemic. And of course, we're putting in unprecedented sums into the NHS, and we work to make sure that everybody has the best possible working conditions, both now and in the future.
Thank you,
Mr. Speaker. LGBT so-called conversion therapy is an abhorrent and fraudulent practice. So please, will my right honourable friend confirm to me and all my Conservative colleagues and across the House who care deeply about this issue that he will do all he can to end this abusive practice at the very earliest opportunity?
Yes, I will. I agree wholeheartedly with my honourable friend that so-called conversion therapy is abhorrent. I praise her for the campaign that she's running on this. I agree with the Prime Minister, who from this dispatch box has committed to ensure that this practice is stamped out. We have a review underway, and I make sure that I work very closely with my honourable friend who's done so much to make the case.
Thank you, Mr. Speaker. Care homes in my constituency and right across the country are currently waiting several weeks to access coronavirus tests, and those in supported living still cannot access regular testing. I wrote to the Care Minister last month about this, but I've yet to receive a reply. So will the Secretary of State please confirm today when regular testing will be available and swift testing in care homes and supported living, or will he finally admit that this so-called protective ring for social care simply does not exist?
Yes, Mr. Speaker, we have been rolling out the asymptomatic testing for those in care homes, residents and staff. As she'll know from the statement I gave to the House in July, we had a problem with the supply of tests from one particular company, which caused some difficulties, and we've spent the summer catching up on that programme.
Simon Bench.
Thank you, Mr. Speaker. Would my right honourable friend join me in welcoming the appointment of Joe Whitehead as the new Chief Executive of the Betsy Cadwallader University Health Board in North Wales, and wish her every success with resolving specific issues like the cramped doctors' surgery premises in my constituency of Clwyd South in Hanmer, and more generally in reducing the stubbornly high waiting lists in North Wales.
Yes, Mr. Speaker. As the UK Health Secretary, Whilst, of course, the direct provision of healthcare has devolved, I take an interest in ensuring that we have high-quality healthcare right across the country, and I'm very happy to work with my colleagues in the Welsh Government on improving the delivery of services in Betsy Cadwallader Health Service. I wish the new Chief Executive all the very best, and I'm sure that she will take that service, improve it, and work with her colleagues in this House to make sure that the people of North Wales get the very best health services that they deserve.
Thank you, Mr. Speaker. Having used the coronavirus testing kits produced by Randox, which was awarded a £133 million contract by the government, care homes in Blackburn were told the kits were unsafe and should carry out retests. Now, as the Secretary of State knows, people in Blackburn have worked extremely hard to get the virus rates down. However, when the care homes asked for replacement kits, they were informed that they had already received a quota and no kits would be available until September. Now, on one hand, the government's saying don't use the kits, and the next hand they're saying we have no kits to replace them with. When will the government reassure care homes in Blackburn they will receive regularly test kits and, more importantly at this stage, rapid results on those tests?
Yes, well, in response to the last point, the turnaround time for test results is now the next day for almost everyone. But there has been a challenge with the Randox kits, as referred to just now in a previous question. The test results from those Randox kits that were withdrawn were accurate. The challenge was that the Randox kits did not pass our very high and stringent standards for not being themselves fully as clean as we would have wanted. I am informed by the clinicians that there's no evidence of any health threat from this, but of course we've got to make sure that we protect people as much as possible. Hence, we had to withdraw the kits. As I said, we've got a catch-up programme that's underway.
So they'll be replaced just to help the member. Yes. Okay, Matt Vickers.
Pandemic, I've been volunteering at my local hospital and have seen firsthand the outstanding dedication, enthusiasm and care given by all who work at North Tees. This fantastic award-winning workforce deserve to work in a modern, fit-for-purpose building. Would my right honourable friend join me in visiting this ageing building to see how we can make it fit for the future?
Yes, I'd love to come up to Stockton and have a look round. I've enjoyed my many visits, especially one in December, which went particularly well just before the House reconvened after the general election.
Yesterday, a dear friend of mine died of stage 4 pancreatic cancer. It's a cancer that has the lowest survival rate of all common cancers, and yet it receives less than 2% of funding for cancer research. Half of all the diagnoses come about only after emergency admissions to hospital, because patients commonly visit their GPs 3 or 4 times with symptoms before being referred to a consultant. What will the Secretary of State do to improve early diagnoses of this disease? Because it's killing 10,300 people a year. That's 28 people a day.
Secretary of State. Mr. Speaker, my heart goes out to the honourable member and the family and friends of his friend who he spoke about just now so movingly. He's absolutely right to raise this. The early diagnosis of cancer is a critical part of improving survival rates from cancer in this country. And in fact, we talk in this House over the last 6 months an awful lot about testing and diagnosis of COVID. Frankly, this country needs to increase its testing and diagnosis of all diseases, including cancer. For a generation, we haven't had enough testing, and he's quite right to raise this issue Because it's not just about people coming forward, it's also about then the problems being spotted earlier. We're investing £200 million in more rapid diagnostics centres. We're trying to get diagnostics not just in the major hospitals, but out into the community so that they're closer to primary care. And there's a major piece of work underway, both to recover the backlog that was necessarily built up during COVID, that is underway, and the backlog's down by about half, but also to go further and to never give up on trying to have earlier diagnosis of cancer.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I am now suspending the House for 3 minutes. Order. Order. I call the Secretary of State, Matt Hancock, to make a statement. Secretary of State.
Mr. Speaker, with your permission, and indeed with your encouragement, I'd like to make a statement on coronavirus. The latest figures demonstrate how much progress we're making in this fight against this invisible killer. There are currently 60 patients in mechanical ventilator beds with coronavirus, down from 3,300 at the peak. And the latest daily number for recorded deaths is 2. However, whilst these figures are lower than before, we must remain vigilant. I said in July that a second wave was rolling across Europe. And sadly, we're now seeing an exponential rise in the number of cases in France and Spain. and the number of hospitalisations is sadly rising there too. We must do everything in our power to protect against a second wave here in the UK. So, Mr. Speaker, I'd like to update the House on the work that we're doing to that end. To support the return of education and to get our economy moving again, it's critical that we all play our part. The first line of defence is, and always has been, social distancing and personal hygiene. We will shortly be launching a new campaign reminding people of how they can help to stop the spread of coronavirus. Hands, face, space, and get a test if you have symptoms. Everyone has a part to play in following the social distancing rules and doing the basics. After all, this is a virus that thrives on social contact. And I'd like to thank the British public for everything they've done so far, but we must continue and we must maintain our resolve. The second line of defence is testing and contact tracing. We have now processed over 16 million tests in this country, and we're investing in new testing technologies. This includes a rapid test for coronavirus and other winter viruses that will help provide on-the-spot results in under 90 minutes, helping us to break chains of transmission quickly. These tests do not require a trained health professional to operate them, so they can be rolled out in more non-clinical settings. We now have one of the most comprehensive systems of testing in the world, and we want to go much, much further. Next, contact tracing. NHS Test and Trace is consistently reaching tens of thousands of people who need to isolate each week. As I mentioned in answer to a question earlier, Mr. Speaker, on the latest week's data, 84.3% of contacts were reached and asked to self-isolate where contact details were provided. Since its launch, we've reached over 300,000 people who may have been unwittingly carrying the virus. Today, we also launch our new system of pay to isolate. We want to support people on low incomes in areas with a high incidence of COVID-19 who need to self-isolate and are unable to work from home. Under the scheme, people who test positive for the virus will receive £130 for the 10-day period they have to stay at home. Other contacts, including, for instance, members of their own household, who have to self-isolate for 14 days, will be entitled to a payment of £182. We've rolled out the scheme in Blackburn with Darwen, Pendle and Oldham, and we'll look to expand it as we see how it operates on the ground. Mr. Speaker, the third line of defence is targeted local intervention. Over the summer, we've worked hard to integrate our national system with the local response, and the local action that we're taking is working. In Leicester, as the Honourable Gentleman opposite knows well as local MP, in Luton, and in parts of Northern England, we've been able to release local interventions because the case rate has come down. We also now publish significantly more local information, and I've put in place a system for building local consensus with all elected officials, including colleagues across this House, wherever possible. Our goal is that local action should be as targeted as possible. And this combination of social distancing, test and trace, and local action, this is a system in which we all have a responsibility to act, and this gives us the tools to control the virus while protecting education, the economy, and the things we hold dear. Meanwhile, work on a vaccine continues to progress. The best case scenario remains a vaccine this year. While no vaccine technology is certain, since the House last met, vaccine trials have gone well. The Oxford vaccine continues to be the world leader, and we've now contracted with 6 different vaccine providers so that whichever comes off, we can get access in this country. While we give vaccine development all our support, we will insist on safety and efficacy. I can update the House on changes to legislation that I propose to bring forward in the coming weeks to ensure that a vaccine approved by the MHRA can be deployed here whether or not it has a European licence, because the MHRA standards are equal to the highest in the world. And furthermore, on the development of the vaccine which proceeds at pace, I will shortly ask the House to approve a broader range of qualified clinical personnel who can deploy the vaccine in order of clinical priority, again, as I mentioned in questions. Because as well as the potential vaccine, we also have a flu vaccination programme the biggest flu vaccination programme in history to roll out this year. Finally, Mr. Speaker, in preparation for this winter, we're expanding A&E capacity, we've allocated billions more funding to the NHS, we've retained the Nightingale hospitals to ensure the NHS is fully prepared, and we published last month updated guidance on the protection of social care. As well as this, last month figures showed a record number of nurses in the NHS, over 13,000 more than last year, and record numbers both of doctors and nurses going into training. Mr. Speaker, we're doing all we can to prevent a second peak, to prepare the NHS for winter, and to restore as much of life and the things we love as possible. As schools go back, we must all remain vigilant, and throughout this crisis, we all have a role to play. This is a war against an invisible enemy in which we are all on the same side. And as we learn more and more about this unprecedented virus, so we constantly seek to improve our response, to protect the health of the nation and the things we hold dear. And I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth.
Well, Mr. Speaker, we are indeed all on the same side in fighting this virus. And I hope the Secretary of State understands that when we raise issues, we do so because we urge the government to improve its response to fighting this virus, because this remains a lethal virus. And for many, it leaves them with serious, debilitating sickness. So everything must be done to drive down and eliminate infections and suppress the virus completely. With that in mind, I hope the Secretary of State can answer a few questions today, and I'm grateful for his advance sight of his statement. First of all, in order to avoid a second national lockdown, which we all want to avoid, an effective test and tracing regime is absolutely vital. I listened carefully to the figures that he outlined, but he didn't tell the House that of the numbers actually going into the system, they have actually fallen in the last week, down from 79% down to 72%. This system is not yet world-beating. Throughout questions, he's rejected criticisms of the private sector contractors who are involved in delivering this system, so there's no point in me raising that again. But the fundamental point is, wouldn't it not be better if money was spent investing in local public health teams, particularly in those areas where there are restrictions in place, so they can do more door-to-door testing, as we've seen, for example, in Leicester? Surely that would be a better use of public funding, for example, than paying for so-called influencers on Instagram to big up test and trace. Now, on testing itself, he now supports mass testing as a policy aim. It's something I've been calling for some months. It's something the former Health Secretary, the Chair of the Health Select Committee, has been calling for. Indeed, we tried to persuade him of its merits before the summer when we asked him to introduce regular testing of NHS frontline staff. He whipped his MPs to vote against it. But will he now, given that he's in favour of mass testing, introduce regular weekly testing of all frontline NHS workers? But to move to mass testing means evolving our testing regime from one which provides antibody tests and the diagnostic PCR tests to effectively a system of mass screening using more rapid on-the-spot antigen tests. He referred to rapid tests in his statement. Can he tell us when rapid on-the-spot antigen tests will be rolled out across society and which sectors of the workforce will be first in the queue to access those rapid on-the-spot antigen tests? Will he now also look at introducing saliva testing? It's being used in Hong Kong, for example. It will ensure the quick turnaround of tests. And I wonder if he's seen the study from Yale that suggests saliva testing could be as sensitive as the nose and throat swabs. What is his attitude towards pool testing? Because pool testing would surely increase the capacity in areas of low prevalence. Does he have a plan to introduce pooled testing? And will he allow GPs to carry out testing, or at the very least allow them to arrange a test for their patients directly? They currently have to ask their patients to log on to the national system, which is causing huge delays. Now, on local lockdowns, he said he wants to involve MPs and elected officials. What process will be used to properly consult local members of Parliament? What can MPs expect? And when a decision has been made to put a local area into restriction, will he publish the specific evidence behind that decision? Why is it, for example, that in Leicester, that our constituents in Leicester are not able to gather in private gardens? Can he publish the scientific evidence for that decision? In Trafford, we've seen infections increase. Now, the local authority leader and the Director of Public Health felt that restrictions should continue, but the Right Honourable Member for Altrincham Sale felt that they should be lifted. Why did he overrule the advice of the Director of Public Health and instead endorse the representations of the Chairman of the 1922 Committee? There was a similar story in Bradford, and in Bolton, where restrictions are due to be lifted tonight, infections are increasing. So is it still his plan to lift restrictions tonight in Trafford and Bolton, even though infections are actually increasing compared to where they were last week when he made his initial decision? He is right. In the end, a vaccine is our best hope to stop this pandemic. Vaccines save hundreds of millions of lives every year, and I repeat my offer to work with him on a cross-party basis to promote uptake and challenge the poison of anti-vax myths, including those that we witnessed at the irresponsible and dangerous demonstration this weekend in Trafalgar Square. We will work constructively with him on the proposals he is bringing to the House, but does he share my concerns about those leaders such as Putin and Trump who are trying to shortcut testing to rush out a vaccine, undermining safety and efficacy, potentially damaging millions of lives and giving succour to the anti-vax movement? And finally, Mr. Speaker, health protection is built upon good population health. Poverty makes people sick. Ending cuts, tackling deprivation and the determinants of ill health is vital to improving people's health and protecting people's health. But he is now embarking on a risky, distracting restructuring of Public Health England in the middle of a pandemic. I know Tory MPs like to blame Public Health England because it's such rotten luck that these decent, hard-working, competent ministers are always let down by the people who work for them. But isn't the reality that this restructuring will sap morale and sap focus and should wait until the end of the pandemic? Mr. Speaker, the UK has suffered the highest per capita death rate of any major world economy. To get through this winter safely, our NHS and public health services need resources and staff need PPE, fair pay, security and support. I hope he can deliver that.
Thank you very much indeed, Mr. Speaker. I'll answer as many of his questions as possible. The first question about the effectiveness of NHS Test and Trace is a very important question. He's right that we are investing in public health teams, and so we should. And as we discussed in questions, it's important to have the combination of the national system and the local. It's also very important that we communicate to people that it's important to engage in testing and the contact tracing for those who test positive and their contacts. And so being able to communicate to people so that they get those messages is very important. And we'll do that in whatever way is effective to get those messages across. He asked about the importance of mass testing. I bow to no one in my enthusiasm for mass testing. I'm very glad that he supports my drive for mass testing. He might remember the exchanges that we had some time ago when I rather stuck my neck out in pushing for mass testing when we needed to get to hundreds of thousands of tests. Well, we need to increase the number of tests again. He mentioned both saliva tests and pool tests. We're trialling both of those. But as with vaccines, which I'll come on to briefly, Mr. Speaker, we will only use testing that is validated and that is where the results are safe. So it's important that we use the world-class facilities that we have at Porton Down to make sure that tests are validated before we use them in public. But saliva testing and pool testing are both options that we are working on. When it comes to local lockdowns, Mr. Speaker, local lockdowns are working. This local action, again, jointly between national and local government, is having an effect, and he knows this well from Leicester, where the case rate is right down. We absolutely do publish the data on which these decisions are made, and in fact, from last Thursday, now published data at lower super output area, which is the lowest level in terms of how local the test results can be reasonably published. And we have extensive data provided to directors of public health. It is important that all elected officials are engaged in the process of making that decision. So as we set out last week, the week before last, we are requiring councils to seek consensus with local elected officials, which includes colleagues in this House. So, for instance, if your area, Mr. Speaker, were under consideration for the need for intervention, we would require your council to seek consensus with you. That consensus isn't always possible, and there have been a couple of examples where it hasn't been possible, and then we will take as targeted intervention as possible, because we want to get to the point where everybody is on the same side in the battle against the disease. And I'm glad to say that in nearly all council areas that process has worked well, and I urge all council leaders to engage with their local MPs, with colleagues from across the House, to make sure that colleagues' views are taken into account, to try to seek that consensus. On the vaccine, he raised the point that a vaccine must only be deployed when safe and effective, and he's completely right. He and I are as one, along with every single member of this House, in our abhorrence at the anti-vax people who peddle lies, and abhorrence actually at the anti-test people who similarly try to argue that testing is somehow wrong when it is not. In the UK, a vaccine will only be deployed when it is safe and it's signed off by the regulator. The MHRA, the UK health regulator, is one of the finest regulators in the world. It is robust, it is independent, and it is technically brilliant. People should know that we will only sign off a vaccine when it's safe. But having said that, we also will work incredibly hard and give all the resources that the vaccine development teams need to try to get a vaccine over the line as quickly as possible.
Chair of the Select Committee, Jeremy Hunt. Thank you, Mr. Speaker. The Secretary of State has made impressive progress in making testing available to everyone with COVID symptoms, but I wonder if I could press him on the availability of tests for people who are asymptomatic. Could he confirm that it is the government's intention to introduce regular weekly testing for NHS staff, teachers, other people who are in regular contact with the public who could transmit the virus potentially, even if it can't be done right away? It is the intention to do it as soon as possible, because surely that is the best way to reassure patients that their hospital is safe and parents that their kids' school is safe as well.
It's my intention to deploy as much testing as possible using the new testing innovations that are coming on stream, and to deploy it as widely as possible following clinical advice. We've set out the process that we propose to use for on the current generation of testing capability, but if a new, easier type of test gets over the line, then of course we'll always keep that under clinical review and guided by the clinicians.
We're now heading to the SNP spokesperson, Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. Is the Secretary of State aware that some people are being refused home testing kits because the credit checking company TransUnion hasn't found their names on the public version of the electoral register? Can he explain why he contracted this American company to verify people's identity and what he'll do to resolve this issue? He still hasn't addressed the poor performance of Serco, who have failed to trace 40% of contacts and apparently didn't even have contact details for over 2,500. This compares poorly to the public health-based systems of the devolved nations, which are managing to trace 90% or more. So instead of breaking up PHE, will he not provide them with the necessary resources to develop a public health-based tracing system for England too? Finally, Mr. Speaker, Chris Whitty said it isn't possible to open up everything and keep the virus under control. while it is really good to see deaths from COVID fall, new cases in the UK are currently higher than when we had to go into lockdown in March. So if getting children back to school is his government's priority, why are they pushing people back into offices at the same time?
Thank you very much, Mr. Speaker. I've addressed several of the points in questions already, and this idea that instead of the large-scale national system working together with the local contact tracers, that we should disparage one part of it and praise the other. This divisive approach that's proposed by the SNP spokesman is wholly wrong and would lead to things getting worse, not better. Instead, we need to work together to improve the system in the same way that the Scottish Government and the UK Government work together to provide a testing capability right across Scotland. On the question also of the arrangements in terms of the future of PHE, we look around the world at the best way to ensure that we have the systems at a national level that can respond to the virus, in the same way that we put in place the Joint Biosecurity Centre, where we work closely again with the Scottish Government, the Welsh Government and the Northern Irish Administration to make sure we have the best possible system, for instance, when cases move over the border. Some of the best systems in the world, like the German system, have an institute that is dedicated to infectious disease control. I'm absolutely convinced that with the enormous amounts of extra money that we're putting into health protection at the moment, that with that investment and with the extra support that's going in, and with the clarity and dedication of the new National Institute for Health Protection, that will be a step forward. And I pay tribute to all those who've been working in public health England right across the board to keep people safe during this crisis.
John Morrissey.
Thank you, Mr. Speaker. I welcome my right honourable friend's announcement of 2 groundbreaking tests that will allow for the coronavirus to be tested in less than 90 minutes. And will my right honourable friend agree and aim for these tests to be rolled out as soon as possible, particularly in care homes? And could I suggest that the rollout begin in Buckinghamshire, particularly in Beaconsfield?
I'll certainly look into the rollout starting in Buckinghamshire. Thankfully, Buckinghamshire has a relatively low rate of the virus, and that is good news. And we're working to ensure that the testing system in Buckinghamshire is as effective as it possibly can be, including using this new generation of testing when we can begin to roll it out more broadly than the current pilots.
Cancer is rapidly becoming an even bigger catastrophe than anything else. The number of new cancer patients presenting is down by more than a quarter this year. The number of appointments for cancer specialist treatment is down by more than a quarter. The amount of money available for clinical trials has completely fallen through the floor. There's a real danger that lots and lots of people are going to die of cancer this year unnecessarily when there is treatment that could be available and that new treatments won't come online. Will you please put together a single task force to deal with cancer during this process? Increase the amount of money for new kit, in particular radiotherapy. Make sure we've got enough pathologists and histopathologists and haematologists for the future, and make up the additional money for the clinical trials.
Absolutely, the point he makes about the research is important, and in the places where research has paused because of the virus, the programme of Restart is well underway. I'm glad to say that the backlog of cancer cases that increased because during a pandemic it is not safe to treat cancer, and because of some of the surgery that had to be paused, we are now halfway through recovering that backlog on the latest figures. Obviously, that recovery is incredibly important, and so it's important to look at the catch-up as well as the absolute drop in overall delivery of cancer services, and critically important that people who fear they may have cancer do come forward to the NHS.
Thank you, Mr. Speaker. I thank the Secretary of State for his statement. My question today is about support for people with mental health conditions during COVID-19. One of my constituents, Nicola Kowalski, went missing just over a week ago. Thankfully, she was found within 4 days. During 2018 and 2019, there were approximately 176,000 reported incidents of people going missing. And charities like Missing People have highlighted the huge strain COVID-19 pandemic has put on people with mental health issues. And charities working in this sector have had to have budget cuts. Can I ask the Secretary of State this? Will he do everything he possibly can to ensure that individuals who suffer from mental health conditions during COVID-19 get the support they need as part of the wider COVID-19 strategy?
Mr. Speaker, and the honourable gentleman my honourable friend is absolutely right to raise these issues. They're very important, and I acknowledge and I can see the challenges that mental health services are under. There's some cautiously positive news that's been announced today by the Office of National Statistics, showing that the number of suicides during the pandemic, the peak of the pandemic, is down from 10.3 per 100,000 to 6.9 per 100,000. But of course, we've got to make sure that we have mental health services there for people as we come out of lockdown, and people are able more easily again to access mental health services, and that we do all we can to support those people who need them.
Thank you, Mr. Speaker. On the back of the Secretary of State's answer to my honourable friend, Member for Ronda's question about cancer, obviously winter time is a time there are huge pressures on the NHS services. In recent years, there have been pressures on acute beds. So will the Minister be able to tell us more about his plan to tackle the backlog to deal with cancer patients and about the treatments they'll receive in the winter time?
Well, yes. He's right to raise exactly this point. Now is the time to be getting through as much of the backlog as possible, and at the same time we've introduced changes to the way that the NHS operates to be more risk-based, so that the infection control procedures, which are important, can also be more risk-based to try to increase the amount of surgery that can happen, essentially splitting the NHS into areas that are deemed COVID green, that is to say they are secure from COVID, and COVID blue, which means the areas where there may be COVID, in order to be able to allow the throughput of surgery to increase. Of course, cancer services have continued all the way through, but obviously they were diminished during the peak. With winter coming, we want to make sure that we put the extra funds into the NHS to try to ensure that those services can continue all the way through as much as is possible. And the flu vaccination programme is a very important part of protecting the NHS from higher demand this winter.
Can I just help the House by saying we're going to finish at 4:40, and I'm sure the Secretary of State wants to help as many backbenchers ask their questions with shorter replies. That will be helpful. Greg Smith.
Thank you, Mr. Speaker. Can I thank my right honourable friend for the announcement last month of £900,000 extra for Buckinghamshire Healthcare NHS Trust to upgrade A&E facilities in the county ahead of winter, which will make a huge difference as we continue to battle coronavirus as well as prepare for other winter illnesses. What assurances can my right honourable friend give me that those very welcome upgrades will be completed in time for this winter to treat Buckinghamshire patients?
Mr. Speaker, it's very good that we've been able to give funds to A&Es, over 100 A&Es across the country, to expand, both to be able to cope with infection control procedures and also to ensure that there's more space. And I pay tribute to the Minister of State for Health, who has driven through this programme along with the NHS, and I'm confident that this can be built in time for winter to make sure that by December we are ready.
Mr. Speaker, all of West London rejoiced when this Secretary of State axed the Shaping a Healthier Future programme of his predecessor. So can he now stave off the rumours circulating that the stopping of services at Ealing Hospital, which it would have put an end to as we know it, do not mean that that closure programme is coming in through the back door. There's a lot of rumours around. And can you start by firstly restoring in full CPOD surgery and trauma services so that we ward off that second spike that he and I both don't want?
We have indeed stopped Shaping a Healthier Future, as it was called. We are continuing with the investment into primary healthcare services that was a part of that programme, but not with the rest of it. And I'm very happy to arrange a meeting between the Minister of Health, who is brilliant on this stuff, and her and other West London colleagues to ensure that that commitment is kept to.
Thank you, Mr. Speaker. Can I thank the Secretary of State and his department for the additional funding for Milton Keynes Hospital, £1.5 million for winter preparedness. And can I also stress and hope that he agrees with me that it is not just the threat of COVID this winter, but also the dual threat of the winter flu as well.
Yes, both of my colleagues, Mr. Speaker, from Milton Keynes have been assiduous in making the case for the need for expansion at Milton Keynes Hospital, and the team there have also been absolutely brilliant, even whilst the Chief Executive has also been stepping up to national responsibilities in response to this crisis. I hope that the expansion of A&E will help ensure that my honourable friends' constituents can get access to emergency services when they need them.
Monera Wilson.
Mr. Speaker, given the Secretary of State decided to announce the scrapping of Public Health England in the middle of recess when there was no opportunity for parliamentary scrutiny, I find it astonishing that his statement did not make a single reference to this bureaucratic reorganisation in the middle of a pandemic. The King's Fund describes scrapping PHE without a full public inquiry as finding it guilty without a trial. The Prime Minister has committed to an inquiry. Will he now set out when that inquiry will happen?
Well, Mr. Speaker, this is all about making sure that we are as well prepared as possible for tackling this virus and ensuring the total focus of the new National Institute of Health Protection on the prevention of infectious diseases. And I've set that out very clearly, as I did in my speech. But there are sometimes when you do have to move and make changes to try to make sure that our systems are working as effectively as possible, and critically to bring together the different parts of the infection response that had ended up in different places and needed to be brought under single leadership.
12 is withdrawn, so we're going up to Scotland to Stuart C. MacDonald. Stuart C. MacDonald.
Thank you, Mr. Speaker. Can I ask what work is ongoing to ensure all the PPE needed by the NHS this winter is procured in good time? And will details of all previous PPE contracts be published immediately in order to address serious concerns about the appropriateness of some of those earlier deals?
Yes, absolutely. We're working very hard now to ensure that we have PPE not only for now and for winter, but also to rebuild the stockpile that we used during the peak of the pandemic, and to make sure as much as possible of the PPE available and used in this country is made in this country, so we're less reliant on international contracts and on the international flow of PPE, which obviously became difficult at the height of the crisis. So absolutely, we are as one. We are one United Kingdom in ensuring we have the provision of PPE for now and in the future.
The Secretary of State agree that to achieve the biggest ever flu vaccine programme, we'll need local GPs and pharmacies to work together and not compete for revenue. So can you find a way of incentivising that working together and not fighting for every jab?
Look, it's incredibly important that pharmacists as well as GPs and others are able to make the flu jab, and we've got to make sure that happens as effectively as possible. It is a massive operation. I'll talk to if we can have a discussion about the specific problems that he's found to try to resolve them, but it is going to be one huge national effort.
Speaker, and thank the Secretary of State for all he's done for the. He's not been found wanting when it comes to responding in the way that it should be. Can I ask the Secretary of State, can he further outline when he has viewed routine operations such as tonsillitis and hip, knee and shoulder replacement surgeries, and when will the Secretary of State be able to address the massive backlog that has occurred because of coronavirus but must now be worked on?
Yes. Mr. Speaker, we are working through that backlog, and I'm glad to that over the summer we were able to recontract with private providers of healthcare to help us to get through that backlog on a better contract than before, better value for money. And I pay tribute to the private providers of healthcare who've been there delivering improvements for people throughout the summer and now on into winter. They play an important part in improving people's health, and it's a big team effort.
Thank you, Mr. Speaker, and it's very reassuring to hear how far we've come in terms of our lines of defences against this invisible killer over the last 6 months. And can I thank everyone through the Secretary of State who's helped us get here. On this second line of defence, the one on testing, can I get an update on how the NHS is working with the private sector to make sure that all aspects of our economy can reopen safely?
Yes. If I understand the question correctly, the ability to provide tests to parts of the private sector who need to know that people don't have the virus in order to be able to reopen parts and parts of the economy or just enable things to happen, that is a very important part of where we'd like to get to when we have the next generation of testing. At the moment, it is, of course, we have to follow a clinical protocol in terms of the rollout of that, of the use of the capacity we've got. We have got a very significant capacity, having built it up over the pandemic. But the work with the private sector is very important, and we will be publishing more details on this shortly.
Sent to Southland with Clive Efford. Clive Efford.
Thank you, Mr. Speaker. Secretary of State, I've had personal experience of track and trace over the last couple of weeks. And having filled in my initial form, I was then contacted at least 3 times to ask for the same information again. So it's not just a question of the contacts, it's also about what's being done with the data. And my assessment of it, that it's poor management of the data, that there is a waste of time and effort and duplication, and they're contacting members of my household, telling them to isolate from the wrong date. So there are improvements that are needed to what is done once track and trace are getting in touch with people. Do you agree?
I'm very happy to look into these individual circumstances. Of course, we're constantly seeking to improve it. I'm very glad that he was contacted so assiduously by the system, and I take the point on the need for the data to be collected as effectively, as efficiently as possible. I hope that he and members of his household are following the rules and doing the isolation that's necessary.
Jack Brereton.
Thank you, Mr. Speaker. Following the recent outbreak in Stoke-on-Trent, I'd like to thank the local authorities and the community for their actions which have helped to stem the spread of the virus locally. Would my right honourable friend agree it is thanks to these rapid actions that we are now seeing COVID-positive results decline, and everyone must continue to play their part by closely following the government guidelines if we are to see cases fall further?
Mr. Speaker, Stoke-on-Trent is another example of a local action that worked. We didn't have to go to a full lockdown. I'm very glad about that. But the combination of enhanced support from the national system, plus assiduous work locally, and the responsible and strong voice of the local MPs, including my honourable friend, has meant that the cases are coming right down, and I'm very grateful to the people of Stoke-on-Trent for responding as positively as they did to what were challenging circumstances, which at one moment looked like it might lead to a full-blown local lockdown, but that didn't have to happen because Stoke-on-Trent got in there fast and acted.
We're heading to Ealing North with James Murray. James Murray.
Thank you, Mr. Speaker. The Secretary of State mentioned the importance of local efforts in keeping infections down. And so can the Secretary of State therefore tell me what additional financial support the government will now provide to support local test and trace efforts, specifically in those areas where the level of infection places them on the watch list or under lockdown?
Mr. Speaker, we do enter into these sorts of discussions. Of course, local councils have a statutory obligation as well, but what matters most is that the response is as effective as it can be, and thus far we've been able to ensure that the councils do have support and the capability to be able to respond. But of course, for local councils with their statutory duties, it's absolutely at the top of their priority list to prevent a local outbreak as well.
The truth is that young people of working age who are fit know there's very little chance of them becoming seriously ill from this thing. Now, I know the Secretary of State will say, yes, but they can pass on to older people. May I just speak on behalf of older people? I'm one. I think I'm the oldest person here, 70, still kicking, just. And what I can say to him is older people don't want to be patronised. They're very well aware of their own health needs. They can be trusted to isolate if they have to. We don't want to have this thing that the man from Whitehall knows best. The man from Whitehall doesn't know best, especially as he changes his mind every 2 minutes. So can we get back to being a proper Conservative government and trusting the people and let the people decide of their own health?
Well, I can. The challenge is that people will. This disease passes on without people knowing, and I've seen this. The challenge of trying to of older people trying to stay away from and safe from a continuing spread, and we saw it in the United States of America, where at first the increases in rates were amongst younger people, and then it spread, and then the hospitalisation rate went up, and then the number of deaths went up. And unfortunately, we're seeing a similar pattern on parts of the continent. So I understand where my right honourable friend is coming from. The goal is to have as little intervention, as targeted intervention as possible, subject to keeping the virus under control. And that is what we're trying to do, and essentially to protect the ability of schools to go back, to make sure that we get the economy going as much as possible. These localised interventions, whether through test and trace to the individuals who've tested positive or to a local area where there's an outbreak, is the approach that we propose.
Heading to South London, to Lewisham with Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. ONS data shows that 75% of disabled people are extremely worried about life post-lockdown, and a further 46% report that this is having a serious impact on their mental health. Will the Minister tell me what the government is doing to support them, and will he commit to ensuring that disabled people who have felt like an afterthought throughout this crisis are at the heart of any recovery plan, as called for by Scope and many other charities?
Yes, absolutely, and the approach that we have of ensuring that the support that's given, for instance, and including in the vaccine, if and when that comes, that the support that's given goes to those who are clinically most at risk, is absolutely the answer to ensuring disabled people get the support that they need. Now, different people who are disabled for different reasons have different needs. And we must be cognizant of the fact that we shouldn't say that treat all disabled people the same with different disabilities. Instead, we should support people with their needs, and that's at the heart of the approach that I take.
Thank you, Mr. Speaker. Does the Secretary of State agree with me that the recent coronavirus outbreak from the Crown and Anchor pub in Stone in Staffordshire, next to my constituency, demonstrates how vital it is that we all, including businesses, do follow the track and trace guidance that has been put in place. It is vital we can reopen safely our economy and also control this virus.
Yes, absolutely. And everybody has a role to play, and businesses have a role to play, especially, including with the contact tracing, so that people can safely go to the pub, and then if there's a problem, they know that they can be contacted, and we all have that part to play.
Judd Thompson.
Yeah, thank you, Mr. Speaker. Does the Secretary of State share my concern that of the £2.5 billion of COVID-related government procurement activity, at least £1 billion of that has been awarded without recourse to open competitive tendering, including a contract to a close friend of the Prime Minister's chief advisor? Why is it that 6 months into this pandemic, the government is still citing unforeseen circumstances to explain a lack of openness in the tendering process for contracts?
Mr. Speaker, we need to move fast sometimes in the response to a pandemic, and we need to move fast to contract with those who are best able to provide the support that that people need. This constant attempt by the benches opposite to try to divide people in this way runs precisely counter to what people want to see. What people want to see is people working together instead of this divisory tactics.
John Bailey.
Thank you, Mr. Speaker. Mr. Speaker, can I actually start by thanking my right honourable friend and his officials for the way in which they've communicated with myself and my colleagues in Sandwell, as we've seen some rather concerning figures, particularly during the summer. And turning to that, Mr. Speaker, can I just ask my right honourable friend for a point of clarification? We've had a unique situation in Sandwell where certain parts of the borough have had exponential rises in the number of cases, which have been very localised, and other parts of the borough, particularly in the west, in my communities in Wednesbury, Albury and Tipton, have thankfully been quite low. So can I just ask, when it comes to local interventions and local restrictions, could my right honourable friend confirm that it is a targeted and pragmatic approach that the authorities should be taking when instituting these restrictions?
Well, that's absolutely right. And if you think about it, from the first nationally imposed local lockdown of Leicester, we worked with the local authorities to decide what the appropriate geography was. And it is not necessarily the entire local authority geography. And in the very first of those interventions, in fact, we worked with the Leicestershire leaders to decide what areas should be in. And my honourable friend, the Minister of State, is one of the representatives of that area, is nodding away. And indeed last week, in parts of West Yorkshire, we went down to a sub-local authority geography. So that is absolutely part of one of the options that's available. Sometimes we go to local authority level, sometimes it's a sub-local authority level. We are driven by the data.
We're now heading to Andrew Gwynn in Denton and Redditch. Andrew Gwynn.
Thank you. The Secretary of State's always rightly claimed that he's guided by the science and data, so I welcome his decision to release Stockport from local measures. The data, the Director of Public Health, the Council and the borough's 4 MPs support it. But I represent a cross-borough seat. Local measures have been tough for us and we need confidence in them. So does he understand the interconnected nature of Greater Manchester's boroughs? And what's his message to my Tameside constituents? That the decisions he's made to lift Bolton and Trafford, where COVID is now spiking, won't keep the rest of us in lockdown for longer?
Secretary of State.
Well, this question and the detailed local nature of the question shows how important it is that we engage with local representatives, including colleagues in this House, so that the local intelligence that, for instance, the honourable member has can be brought to bear on this decision. Now, the decision that was taken in terms of taking Stockport out and leaving Tameside in the measures was taken with the agreement of the leaders of both councils, and I absolutely concur with him that we should have as targeted approach as possible, and that local councils need to ensure that if it's appropriate for some of their area to come out and some stay in a local lockdown, that's what we should do. We should be driven by the data.
Mary Robinson.
Thank you, Mr. Speaker. Joint partnership working and effective test and trace have been essential in ensuring that we've reduced the COVID cases in Cheadle and also kept the pressure off our NHS. Public Health England have indicated that the flu jab is one of the most effective measures that we can take in order to further reduce the intensive care pressure on intensive care units. Would you agree with me that in order to avoid a flu outbreak at the same time as we're tackling coronavirus, we really need to encourage people to take up these flu jabs and ensure that we get both the test and trace and the flu jabs working in conjunction?
Yes, I emphatically agree with my honourable friend. I couldn't have put it better myself.
Daniel Zachner.
Over the next few weeks, hundreds of thousands of students will be returning to universities, which is very, very welcome. But what we're seeing at the moment is that each institution having to make its own decisions. Universities UK tell us most students will be getting in-person teaching. What advice is the Secretary of State giving to those universities, and what support is the Department giving?
We're working very closely with the Education Department to have a successful and safe return of universities in the same way that from today onwards we're seeing a successful and safe return of schools.
Dr. Luke Evans.
I'm really pleased to hear my right honourable friend talk about the largest flu vaccine programme ever being put in place, in particularly for those over the age of 50. Now, in normal times, that would be a challenge, and in light of COVID, that's going to be even more difficult. I'd be grateful if he'd talk about what steps he's taking in terms of the practicalities to making sure things are simple and secure to deliver it, but not too prescriptive for those delivering the vaccine. And whether or not funding is there adequately to support the flu vaccine, and any other steps he's taking to make sure we have a successful flu vaccine campaign over the winter, given COVID.
Thank you, Mr. Speaker. We are putting enormous sums into the flu vaccine programme and have released extra funds in order to buy more vaccine. We are deregulating and making sure that we have a wider group of people who will all be clinically qualified who can administer the flu vaccine. And those regulations will come before the House shortly. And he's right to say how important it is to get the communications out that everybody should get a flu jab. We'll start with the free jabs for the over 65s, the frontline healthcare workers, and those who are clinically vulnerable. We'll then move to the 50 to 64-year-olds, but everybody of every age can get one. It's just not free to others. And I will encourage everybody to get one, and we must tackle these rumours that we get online that spread the pernicious lies about the anti-vax movement.
Clark.
Thank you, Mr. Speaker. Mr. Speaker, only 40% of the 90 care homes in Enfield have had COVID testing to date. So when will the Secretary of State roll out the mass testing promised to care homes, and what progress is being made to increase the use of rapid turnaround tests in care homes in Enfield and across the country?
Yes, we are introducing more rapid turnaround tests and validating that technology. And we are also rolling out asymptomatic testing to care homes. We did have a problem with the delivery of tests from Randox, which was the leading test that we were using with care homes, as I made clear to the House in July. And we've spent the summer recovering that programme.
Mr. Speaker, I welcome the Secretary of State's statement, and with your permission, wish to recognise his and his department's Herculean efforts in leading our national fight against the virus. Now, at this time, throughout my constituency of Wakefield, there exist growing concerns that the lockdown measures to tackle localised spikes of COVID-19, which have been imposed on swathes of West Yorkshire, across the borders and beyond, across the Pennines and beyond, may well be imposed upon Wakefield, harming livelihoods. In order to help manage these fears and encourage adherence to the guidelines, will my right honourable friend publish the criteria which informs his decisions to impose or ease specific lockdown measures in certain areas, such as Kirklees, Greater Manchester and Leicester?
We do publish the data that the decisions are made on, and we've published the so-called contain framework, which is the framework within which those decisions are taken, in consultation with the local authority and local representatives, should such an intervention be needed. What I'd say to residents of Wakefield, and indeed any other area, is the best way to avoid the local action and a local intervention is to follow the social distancing rules, hands, face, space, and get a test if you have any symptoms. And by following social distancing, we are more likely to be able to control the virus without the need then to resort to local action.
David Linden.
Thank you very much, Mr. Speaker. I'd like to start by paying tribute to public health officials and community partners in East End of Glasgow who've been managing some of the local clusters there. It really has been a team effort. But, Mr. Speaker, part of the Secretary of State's test, trace and isolate strategy is based on people following that advice to isolate when they show symptoms. Can I ask the Secretary of State what discussions he's having with BAYS regarding the pitiful levels of statutory sick pay? Because anecdotally, a lot of constituents are telling me that they're worried about the financial pressure of having to isolate. So what discussions is he having with his colleagues in government on that?
As set out in my statement, we've introduced a new scheme today.
Andy Carter.
Thank you, Mr. Speaker. And can I thank the Secretary of State for his statement today? Research around immunity once you've had COVID remains critical. Can I ask the Secretary of State to update us on what progress we have in understanding how immunity is developed and how long it lasts, and what work is being undertaken in terms of rapid testing for immunity and analysis and the technology that sits around that?
Yes, this is a very important question, and essentially part of the research into the vaccine is research into its efficacy, which is about research into the immune response that it provokes, both the antibody response and the T-cell response, both of which have an impact, and it's something that we're doing a huge amount of work on. I'm very happy to write to my honourable friend with more details.
Craig.
Thank you, Mr. Speaker. Could the Secretary of State now answer the question that has been asked repeatedly this afternoon about the creation of the Institute for Health Protection? What persuaded him in the middle of August that it was a great idea to reorganise a structure of public health in the middle of the worst pandemic for 100 years, which is a bit analogous to reorganising the fire brigade in the middle of a blaze?
The importance of bringing together the leadership around the test and trace, the JBC, and the leadership from Public Health England into one place to make sure our response is as effective as it possibly can, and to make sure that we constantly are searching to have the best possible response to this virus.
Anthony Edwards. Brendan Clark-Smith.
Thank you, Mr. Speaker. I know my right honourable friend will share my excitement over the 2 new groundbreaking tests that can detect coronavirus in as little as 90 minutes. Does my right honourable friend agree we should get this tech rolled out as quickly as possible, but particularly in care settings?
Yes, I do. Yes, I do. And I put everything I possibly have got into driving it as fast as possible, subject to it working effectively.
Please.
Thank you, Mr. Speaker. Today's ONS suicide statistics show that middle-aged men remain at the highest risk of suicide. And it's well established that recessions can lead to increases in suicides. But this isn't inevitable. So what will the Secretary of State do to ensure that suicide prevention is a government priority and that this group of people is supported through the recession caused by the COVID-19 pandemic?
Thank you. The Honourable Lady is quite right to raise this. It's good to see the figures showing that suicide rates have fallen, but we absolutely must and will remain vigilant.
Sir Bernard Jenkins.
Thank you, Mr. Speaker. Can I thank the Secretary of State for the written ministerial statement he published after my last question to him in July. Can I ask a bit more about the National Institute for Health Protection? Who was consulted before this decision was made? What is the legal basis for its present operation? Does it require legislation? What kind of public body is it intended to be? A non-ministerial department or executive agency or part of the Department of Health? How will it be funded? When will there be a proper white or green paper on the subject? What will the political appointee put in as interim head be replaced by a properly appointed public appointments approved person? And well, I could go on. There's plenty of unanswered questions.
I counted 8 questions. Let me try to answer them. The National Institute for Health Protection does not require a legal basis. These PHE duties were not done on a legal basis. It will take on some UK-wide responsibilities, but also have responsibilities for England only. It's funded from the Department for Health and Social Care. It will be an executive agency of the department. There is a global search underway for long-term permanent leadership, and as I said in response to the previous question, it will bring together the leadership of several different parts of the response. It was imperative, as far as I could see, to try to make sure that we have that single unified leadership for the next stage of our response to this crisis. I pay tribute to the work of Public Health England, who've done an enormous amount, and especially their scientific work, which has truly been amongst the best in the world and helped us to respond as well as we possibly could. And I think that the new National Institute for Health Protection, established on the basis that I've set out, will make sure that we constantly are learning to have the best response, both in terms of the science and the scale, and deliver for this country.
Chris Elmore.
Thank you, Mr. Speaker. I welcome the Secretary of State's comments in relation to dealing with anti-vaxxers, and he will recall I asked him a question before the recess where he said he was meeting with Sir Nick Clegg, formerly of this House, now of Facebook fame. I wonder if he could update the House on that discussion, because it is still a reality that Facebook is taking millions of dollars from anti-vax sites. It is still the case that there is an increase in people in this country who have a fear of what the vaccination could mean or could not mean. So can I press the Secretary of State to start a campaign to tackle these anti-vaxxers head on and to ensure that all members across the House are able to take a lead in this, because it really is a cross-party issue?
That campaign is underway. We're constantly looking to strengthen it. Of course, Facebook and other social media providers have got an important role to play. I had that meeting with Nick Clegg, who in fact broke off his holiday in order to take the meeting. Zoom reaches all parts. But I think, in fairness to my former coalition ministerial partner, he absolutely understands the importance of this issue, and Facebook have been doing very significant work. That doesn't mean there isn't more that they can and must do, but the response was positive, and further work needs to be done to make sure we get the positive messages across.
Steve Bryan.
Thank you. Secretary of State will know that as somebody who knows PHE well and what it actually does, I have some concerns about the changes that he announced last month. While I can see the arguments around the future health protection side and future pandemics, of which there sadly will be more, I think we do need to know who's taking ownership of the long-term public health work around smoking, air quality, obesity, the childhood vaccinations, the inequalities work that they do. Is he, for instance, considering bringing that experience and vast expertise, which I as Minister have been benefited of, back into DH, for instance?
My former ministerial colleague and a distinguished former public health minister raises an incredibly important point. We are undertaking right now consultation on precisely this question, and in fact I'd invite him to come into the department to give his views. The critical thing is that we need to ensure that we drive the health improvement agenda, the obesity agenda and the wider health improvement agenda forward very, very strongly. Local councils have got a huge role to play in this, and they must be bound yet further into the health improvement agenda. The NHS has a huge role to play, and that must be bound more strongly again. And today's announcement is good progress from the NHS. And so this is incredibly important. We are going to get it right. It is a very high priority of the Prime Minister, and I look forward to working with him on making it happen.
Let's go up to Scotland and visit Martin Day. Martin Day.
Thank you, Mr. Speaker. Will the Secretary of State commit to raising healthcare funding to help prevent a potential second wave, while ensuring Scotland's NHS receives the necessary levels of Barnett funding to help prepare effectively for a potential winter wave, and ensure Scotland's health workers have all the resources that they need?
Secretary of State.
Yes, Mr. Speaker. This country has never increased health spending in a year more than it has this year, and the Barnett consequentials mean that many, many billions of pounds have flowed to Scotland to improve the response in Scotland too.
Final question, Jason McCartney.
Thank you, Mr. Speaker. Will the Health Secretary join me in thanking the people of Kirklees for the sacrifices that they've made during the period of the local restrictions? And as he knows, thanks to the use of localised granular data, much of Kirklees are coming out of those local restrictions tomorrow. Will he continue to work with me, parliamentary colleagues, including my honourable friend, the member for Dewsbury, the leadership of Kirklees, the local Director of Public Health, use that data so that we can very soon get the rest of the areas of Kirklees out of these local restrictions?
Yes, I pay tribute to my honourable friend who has behaved with great dignity in making the argument that people need to follow these restrictions, but that the restrictions should be targeted and based on the data. Our approach is to have objective local action where it is necessary, but only where it's necessary, based on the data. And we've reached a good solution to this question in Kirklees that will be put into force tomorrow. But I look forward to working with continuing to work with Kirklees to make sure that we get the virus under control right across the district, so that every part of Kirklees can be released from these measures, which nobody wants to put in place but are there for a reason.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order.
Order. Order. I call Secretary Gavin Williamson to make a statement.
Thank you, Mr. Deputy Speaker. With permission, Mr. Deputy Speaker, I'd like to make a statement regarding the full opening of our schools and colleges from this week. But before I do, I'd like to update the House on the current position regarding exam results for this year's GCSE and A-level students. As the House will be fully aware, exams had to be cancelled this year because of a COVID-19 outbreak. Students have now received results for GCSE, AS and A-levels, as well as vocational and technical qualifications that will allow them to progress to the next stage of their lives. The independent regulator, Ofqual, had put in place a system for arriving at grades that was believed to be fair and robust. It became clear, however, that there were far too many inconsistent and unfair outcomes for A and AS level students, and that it was not reasonable to expect these to be dealt with even through a boosted and enhanced appeals process. Instead, students have been awarded the grades which schools and colleges estimated they would most likely to have achieved, or their calculated grades if they were higher. Mr. Deputy Speaker, this situation has, I know, caused a great deal of stress and uncertainty, and I'm deeply sorry that those who have borne the brunt of it have been students themselves. I can only apologise to them again for this. We took immediate action to provide certainty as soon as it was clear that if we didn't, too many students would have received grades that didn't reflect their hard work and their ability. For vocational and technical qualifications, the situation was different because most were not subject to standardisation like GCSE and A-level grades. However, awarding organisations that did use a similar model have also reviewed their results. This has been done to ensure that each student has been treated as fairly as possible. We recognise, however, that some students may still be unhappy with their summer grade, and for some there was not enough evidence for any grade to be awarded at all, such as those who are home-educated students. To support these students, we are running an extra exam series in all subjects at GCSE, A and AS levels in the autumn. Additional opportunities will also be provided for some other vocational and technical qualifications which received calculated grades. We've also been working with further and higher education sectors to manage applications for this year's places. To ensure students can progress to higher education, we intend to remove temporary student number controls which have been introduced for the coming academic year. We set up the Higher Education Task Force, and we are working closely with the sector to create additional capacity and encourage them to be as flexible as possible. Providers have agreed to honour all offers to students who meet the conditions of their offer wherever this is possible. In the event that a course is full, universities will give students a choice of suitable alternative courses if they are happy to take it, or a deferred place if they prefer to wait an additional year. This year, many more students have been successful in meeting the required grades to study medicine and dentistry, and the government has removed the caps on student numbers in place on both of these subjects. The Ofqual Board has agreed temporary arrangements with Ofsted to support the ongoing work on this summer's GCSEs, A and AS levels, and vocational qualifications, including appeals and autumn exams, and preparations for next year's exam season. We are determined that exams and assessments will go ahead next year, and we're working with the sector to ensure that this is done as smoothly as possible. The former Chief Regulator, Sally Collier, has decided that the next stage of the awarding process would be better overseen by new leadership. As a result, the Ofqual Board has asked Dame Glenys Stacey to act as Acting Chief Regulator until December 2020. Mr Deputy Speaker, I'd like to take this opportunity to thank Sally Collier for the commitment she has shown over the past 4 years and wish her well. While none of this disruption is what we wanted for our students, I believe that they now have the certainty and reassurance they deserve and will be able to embark on the next exciting phase of their lives. I hope the whole House will join me in wishing all of them the very best for their future. Mr Speaker, I'd now like to turn to the full opening of our nation's schools and colleges. Welcoming pupils back will be a massive milestone for schools across the country. On the 2nd of July, we published detailed plans for nurseries, schools, special schools and colleges that set out what was required to deliver this full return as safely as possible for all of our children. The guidance has been developed with medical and scientific experts and Public Health England and follows regular engagement with the education sector. The recent letter from all 4 UK Chief Medical Officers, which emphasised the low risk of long-term harm from COVID-19 due solely from attending school in comparison to the high risk of long-term harm from not attending school, particularly for more vulnerable children and young people, has, I hope, given parents extra assurance that with the protective measures in place, our pupils are returning to a safe environment and an environment they will gain so much from. As they return, Mr Deputy Speaker, pupils will be kept in consistent groups and older children will be encouraged to distance wherever possible. At a minimum, this will mean keeping whole year groups in schools and colleges separate. This is in addition to the other protective measures such as an enhanced cleaning and hand washing. We've also advised that pupils in secondary schools should wear face coverings in communal areas if there is a local lockdown in place, unless they are exempt. Strict hygiene protocols are in place and PPE is being distributed to every school to bolster their supplies for use in the unlikely event that a pupil develops COVID symptoms on the premises. A small number of home test kits are also being distributed for anyone who develops symptoms and who would not otherwise have access to testing themselves. All schools will also have access to direct support and advice from local health protection teams to deal with any cases that may occur. Together with colleagues from the Department for Transport, we've announced an additional £40 million in funding for local transport authorities to ease pressure on public transport. We've also published guidance for local authorities to manage capacity and reduce the risk of infection on school transport. We have urged all students and staff to walk or cycle to school or college if this is a suitable alternative for themselves. I know that these past few months have been some of the most challenging that schools, parents, and most of all children have faced. I'd like to take this opportunity to applaud all of our dedicated education staff for the incredible efforts that they have made to keep children learning at this difficult time. Mr Speaker, I am confident that we have the necessary preparations in hand to ensure a successful return for all of our pupils, and I commend the statement to the House. Thank you.
Kate Green.
Thank you, Mr Deputy Speaker, and I thank the Secretary of State for his statement this afternoon, but Mr Deputy Speaker, I'm afraid I must complain that I did not receive advance sight of it until 4:36 p.m. You will know that the Ministerial Code required that I should have had it much, much sooner. I'm welcoming the Secretary of State back to his place after a summer of chaos, incompetence and confusion that has caused enormous stress to children, young people, their families and their teachers. Ministers must now learn from their mistakes and ensure that keeping schools open and pupils learning is a national priority. Labour is absolutely clear. We want children back in school and we want them to stay there. I'll always work constructively with the Secretary of State to achieve that, and I hope he will hear my questions this afternoon. in that constructive spirit. Because while I'm delighted that the vast majority of schools will reopen fully in the next few days, there remain many issues of concern. Let me start with the ongoing situation regarding this summer's exam results. After days of confusion following A-level results day, the Secretary of State finally heeded calls from young people and from the Labour Party and accepted the centre assessed grades, the CAGs. And while that was the right thing to do, it leaves many of the problems created by his previous flawed standardisation model unresolved. The Secretary of State should have known of the risks. It's been reported that a former senior official of the department raised serious concerns. So can he tell the House when he first knew of the potential problems with his approach and what he did about them? What advice was he given specifically about BTEC students who faced more uncertainty and delay? Can he now assure us that all BTEC students have received their results? He alluded to external candidates who don't have a CAG, and they remain in a difficult situation. I don't think they will find the offer of resits sufficiently reassuring, but perhaps the Secretary of State can tell us what support they will receive as they undertake those exams. And there are also significant consequences for higher education, as the Secretary of State rightly noted. Can he tell the House how many young people who missed their first choice university because of his now discredited approach to awarding grades have not been granted those places? What assessment has he made of the impact on universities that will lose students because they can now take up their original choice? What discussions has he had with the Treasury about providing those institutions with additional financial support? Mr. Deputy Speaker, turning now to the reopening of schools, we're all pleased to see children return to class. School is the best place for them to be, not only for their learning, but for their emotional and social well-being. And I pay tribute to the school staff who've worked through the holidays to welcome them back safely. The test now for the Secretary of State is that pupils continue to receive a full education throughout the year and catch up on the learning they've lost. So when will pupils begin to receive support through both the catch-up premium and the National Tutoring Fund? And why are the early years and post-16 providers ineligible for the catch-up premium? Why is the funding available for just a single year when the impact of any further disruption to education is so significant? Can he guarantee that every child will have full access to learning in the event of a local lockdown? Parents' top priority as schools return is the well-being of their children. What plans does the Secretary of State have to provide additional pastoral support? What extra support will be available for children with special educational needs and disabilities? Parents will not be able to return to work without childcare and wraparound care. What plans does he have in place to ensure every parent can access the care they need? And can he tell us a little more about how he will ensure all children travel safely to school, including respecting social distancing on public transport? And finally, what additional financial support, if any, will schools receive to cover any additional specific COVID-related costs this term? Turning to the year ahead, Mr. Deputy Speaker, I was glad to read this morning that the Secretary of State has apparently once again listened to Labour and is going to delay exams in summer 2021. Pupils entering Year 11 and Year 13 have already experienced significant disruption to their learning, and the assessment process must recognise that. But schools, colleges and universities need time to plan. So can he say what discussions he's having with the sector and with UCAS to ensure workable arrangements are in place? And can he guarantee that a contingency plan will be put in place this month in case exams are disrupted again? Mr. Deputy Speaker, children and their families should have been the government's top priority. But for weeks, their interests have taken a backseat while the Secretary of State U-turned on everything from CAGs to face masks and left officials to take the blame. He must now take responsibility for ensuring that a summer of incompetence does not descend further into an autumn of disaster and dismay. I implore him to listen to the concerns of parents, of teachers and of the Labour Party. He must now make the education of our children and young people a national, and his personal priority.
Secretary of State.
Well, thank you, Mr. Deputy Speaker, and apologies for the Honourable Lady for receiving the statement late, and we'll ensure that that doesn't happen again in the future. And I'm delighted to hear that it's the party opposite's their priority to see all children going back. It's a refreshing change from the leadership that the Honourable Lady is showing to that of her predecessors, who was more ambivalent about children returning back to school, when this side of the House has continuously argued for children to be back in the classroom at the earliest possible stage. The Honourable Lady raises some important issues about children that are not in a situation where they're in school, so they haven't been able to receive centre-assessed grades. This was always an issue that we recognise that was going to present challenges. That's why that we put forward an autumn series, as there was going to be no other viable way in order to be able to provide that assessment. She raises important points about higher education. This is vital, and I'd also like to flag up some of the challenges